Hi, I'm Dr. Richard Cohn from the Cohn Eye Center in Maitland, Florida, and today we're going to talk about how to use glaucoma eye drops. First, a little description of glaucoma. Glaucoma is a condition where the optic nerve in the back of the eye becomes damaged. This damage is often related to elevated eye pressure, the pressure inside of the eye. Unfortunately, the patient cannot feel when his or her pressure is elevated. The first line of treatment is usually the use of eye drops for glaucoma. The most important thing in glaucoma therapy is continuing to use your drops as your doctor has recommended. When you stop or run out of drops, your pressure starts to rise. Even if only for a few days, when your pressure goes up, little fluctuations in your pressure can still do damage to the optic nerve. In patients who are having bothersome side effects from their drops, it is important to discuss these side effects with your doctor rather than simply stopping the drops on your own. Often there's a substitute or an alternative drop that can be used that has fewer side effects. Again, stay on your drops and try not to run out. So how do we use glaucoma drops? Here's how. I recommend holding the bottle between your thumb and index finger and using your third finger to pull down your lower eyelid. This does two things. It makes a little pouch to catch the drop, but it also creates a brace so that you can't poke yourself in the eye with the bottle. Lastly, it gives you a set distance so that the eye drop is right over the center of your eye, and then we squeeze gently and put one drop in the eye, and then use a tissue from the other hand to dry your eye gently. Don't worry if you get more than one eye drop in your eye at a time. The eye only holds one drop, so if you put two drops in, you're basically treating your eye and your cheek. One drop is going to roll down your cheek. The only problem with that, of course, is that you're going to run out of your glaucoma medicines sooner, and some insurances won't refill them before 30 days. So try to only get one drop in at a time. Regarding glaucoma drops, I'm Dr. Richard Cohn.